Stapedectomy and stapedotomy are two surgical techniques used to treat otosclerosis, a condition causing conductive hearing loss due to stapes fixation. Stapedectomy involves the complete removal of the stapes footplate and placement of a prosthesis. This technique provides better low-frequency hearing gain and may be the only viable method in complex cases where stapedotomy is not technically possible. However, it carries a higher risk of perilymphatic fistula and sensorineural hearing loss. Stapedotomy, on the other hand, is a more modern approach where a small hole is made in the stapes footplate, minimizing trauma to the inner ear. It offers better high-frequency hearing gain and a lower incidence of complications, such as perilymphatic fistula, sensorineural hearing loss, lateralization of the graft, postoperative vertigo, and the need for revision surgery. Additionally, stapedotomy results in more stable long-term hearing outcomes and less labyrinthine trauma. Clinical preference. Surgeons often favor stapedotomy due to its lower complication rates and improved stability. However, in cases with extensive otosclerosis or anatomical limitations, stapedectomy may be necessary. In summary, while stapedectomy is sometimes required, stapedotomy is the preferred approach in most cases due to its better hearing preservation and lower risks. Understanding these differences is crucial for surgical decision-making in otology.